It's currently 5:47 a.m. July 29th, and I'm gonna tell my story because this is ridiculous. It's ridiculous. My name is Karish Michelle, and I have sickle cell disease, sickle cell HBSS, and I was diagnosed at 15 months of age. So I've been living with sickle cell my whole life. If you know me, you know I'm always in and out of the hospital because of pain crises. And recently, I've been starting treatment for gene therapy to get a cure for sickle cell. So I'm currently at the hospital that I've been coming to for 2 years now, which is Jackson Memorial Hospital, the Holtz Children's section, because that's where I'm doing the gene therapy process. And honestly, I've been here for so long, to the point where I've been in and out of multiple crises, and my hemoglobin continues to drop low, critically low, 4.95, and my steady state is usually an 8. And it's just been this back and forth treatment. And so everything was fine until last evening. I have a lazy eye, so when I cry, my lazy eye comes out. But last evening, I started experiencing excruciating pain, severe pain in my legs, my arms, and my back. And, I'm on a PCA pump. This is a button where you can push for the morphine to be administered directly to you. I have a PIC line, and so I'm not on a continuous rate at the moment, so I can push every 15 minutes, and that will give me a bolus push of morphine flow, and I get my morphine every 15 minutes, so I can push 4 times in 1 hour. I've been doing that from 8 p.m., getting morphine by myself, administering it to myself, along with getting prescribed medication from the nurses, such as oxycodone, tramadol, gabapentin, so many other things, Tylenol. And I kid you not, I was having this pain in my legs from 8 o'clock in the night. And the whole night I was telling my nurse, I'm in so much pain, I'm having so much pain, please tell the doctors that I'm having all this pain. The doctors never came. And then I went to sleep, I fell asleep, and eventually I woke up at 3 a.m. in so much pain, in a literal crisis. I'll show you guys. So at this point, I'm screaming for the doctors, and I told the nurse to let them come. The doctors came in, and it was 2 female white doctors. They did not even examine me, take my vitals, ask any questions. They just looked at me, and they realized, like, I was screaming and crying. And so she said, does this have anything to do with anxiety as well? And I said, no, it's just the pain. Like, I'm in so much pain, and I can barely talk. So I was trying to tell them where the pain was. And she was like, okay, we're gonna give you something. Let's just wait for the oxycodone that you just got, because I had just gotten oxy. Let's wait 15 minutes. I wait for 15 minutes. 15 minutes goes by, nothing. I continue pushing my PCA for 15 minutes, and I realized I've pushed every 50 minutes for 3 times, meaning that it's been 1 full hour since I've seen the doctors, and they had not been there. For that complete hour, I was left in the room by myself, screaming and crying in agonizing, excruciating pain. So I ring my bell, and I call the nurse, and I said, I need to speak to my doctors. Like, where are they? They haven't come back yet. And so she comes back, and she said, we're just gonna give you lorazepam. And I said, isn't that just an anxiety medication? It's not gonna help me with the pain. And she's like, yeah, but Ativan can calm down your system, it's a multi-purpose medication, and once you're calmed down, the pain should start to subside. And I'm like, no, that's not gonna help me. I said from 8 p.m. I've been pushing my PTA pump, trying to get the morphine, and it's not been helping. She said, we don't want to give you a bolus with an extra bolus of morphine because you might go into respiratory distress. I'm like, okay, but every single doctor that I've had in the past, anytime that this has happened, they would do my vitals, they would examine me. You didn't do any of those two things. And then, based on those, if I continue to push and it doesn't get better, or if I get a medication like Oxy and it doesn't get better, they would give me a bolus, appropriate enough dose to where I don't have to be at such high risk for respiratory depression. And I was just like, you guys can just do the math and give me a small dose, just something extra that could help with the pain. And she continued to refuse it and just continued talking about this anxiety medication. And I was like, no, like, that's not gonna help me. Like, I'm in literal fucking pain. So then I called my mom, and my mom wanted to talk to her. And at this point, I told her out because she was so rude. And my mom starts asking her the exact same questions. And my mom is on video call, but I didn't show her. So I was looking like this and talking to my mom. And she's asking my mom questions. And as she's answering the questions, she's rolling her eyes. My mom was like, isn't that an anxiety medication? And she's like, yeah. But I spoke to the hematologist and they recommended I gave it to her. And, we don't want to give her this and that. Like, just answer the regular questions. Why are you having an attitude? People do not take sickle cell seriously. Like, she did not take my condition seriously at all. And this is why I'm still in pain. I'm still in so much pain. They gave me the Ativan. They gave me the lorazepam, whatever you want to call it, to calm me down, but I'm still in so much pain and did nothing. And I told them that this would happen. She's still wait 15 minutes. It's been 15 minutes. Nobody has even come back to check up on me yet. Like, they don't even care. They don't care. She was very disrespectful, not only to me, but to my mom. And I feel like she just didn't care. Like, the fact that she didn't even examine me, didn't take my vitals, didn't ask me any questions about the pain. She just looked at me, observed my crying, said anxiety, because I do have a history of anxiety and I'm on Lexapro currently. So she knows my chart. At least that's something she does know. But, like, at the same time, it's microaggressive and passive aggressive to do that to a patient, because I feel like she's stereotyping me. Like, I have pain and the most that you're gonna do is to run and give me an anxiety medication, not something else for the pain. Like, come on. And this is why raising awareness for sickle cell is so important, because we do not get the representation that we deserve. They hear us, but they don't hear us. Like, we're crying out for help right in front of you, and you still can't give it to us. You still can't give it to me. Like, I don't understand. All she did was continue to tell my mom that I'm on a medicine PCA pump and that I can push my button every 15 minutes and that should help. But miss, I told you from 8 o'clock. It's now 4 in the morning. Mind you, they gave me the lorazepam around 5:20 something. They said in 15 minutes it should work. It has not worked. It's 6 a.m. She hasn't even come back to see how I'm doing. But I thought the pushes would help, though. I've been pushing. I thought it would help. Why? It's 6 a.m. It's been way more than 15 minutes since I got the lorazepam. And then he said that would help me. It didn't even calm me down. It's just so unfair. I've been crying so much. Just the type of shit a sickle cell warriors have to go through. Always stand up for yourself, though. Let them see you cry. It's okay to cry. I will be dealing with this, and I will give you guys an update. Thank you for watching. My GoFundMe is linked everywhere on all my social media. Continue raising awareness for sickle cell.
Black women are 3 times more likely to die from pregnancy than white women, and the only reason for it is racism. I'm about to show you 2 really disturbing videos that both came out this week. Both of these women could have died because their white healthcare workers were incompetent and neglectful.
Fuck! When's your due date? Right now! Is your due date? 11. What? You have 2 babies at home?
My daughter is being kicked out of this hospital because she's in active labor.
Video shared by an Illinois father shows the moment his wife, Mercedes Wells, was allegedly sent home from a hospital while she says she was in active labor.
Excruciating pain. She's seen me in pain and agony. And I guess she still perceives me to not be in labor.
Wells was escorted out of the hospital at 6:20 a.m. Minutes later, while driving away, Wells delivered her baby on the side of a road.
Now, I know I don't have to explain why this happened to any of my black or brown followers, but to my white followers, and especially those of you in healthcare, I need you to understand that racism is endemic to our healthcare system, and the only way to fix that is through education. This is also why I have said and will continue to say that without a shadow of a doubt, MAGA healthcare workers are a threat to their patients. Because if you are culturally incompetent enough to think that there is valid leadership in Trump's regime, then you are not going to be able to recognize nor explore the biases that you hold and that you bring to the hospital every day. Now, if you've made it this far and you're a bedside healthcare worker, I'm willing to bet that you agree with me, and I want to give you guys some action points as to what you can do to help the Black maternal mortality crisis. The first thing is going to be listen to Black women, first, foremost, always. But the second thing is we really need to start reporting our racist or suspected racist coworkers to HR. And this is not about being punitive or doing some kind of witch hunt. It is because folks that have not been forced to look at their own racial bias in the face will never do so unless they are forced to. And these people need education. It is a threat to your patients for you to not ensure that those healthcare workers are made aware of their bias. Our patients deserve better. And the only way that we can ensure that there is actual change made in this horrific crisis is to act and do something.
I just feel so sad. I really just feel so sad and exhausted. So, I'm in pain. I'm in agony. And this morning, when I spoke to the doctor, I said to them, like, I'm in so much pain. I can't walk. I can barely walk. I have to have, like, a portable toilet be brought to me. I have to be putting weight on my non-dominant leg, which is very shaky at best. I'm just hopping everywhere. I can't sit up properly because when I sit up, it means stretching my legs out, which is causing me agony. I can't even lay down because laying down hurts as well. Like, I don't even know what to do. And this morning, when I spoke to the doctors, and I said to them, like, I'm really in pain. I'm really in agony. And these people was like, yeah, we hear you. And then I was told by my nurse that they stopped all my pain meds. After I just looked these people in the face and told them that I'm in so much pain. Which just breeds so much distrust. I reached a point in my life where I'm just going to refuse to stop talking to white doctors. I really mean, I won't even look like them. I won't even look at them if they will be standing in the same room as me. I'm actually tired. I'm fucking tired of it. I'm tired of medical racism. I'm tired of them thinking because of my skin tone or because of my illness that I've been dealing with since birth that I have a higher pain threshold and that it's okay to just leave me in pain. I don't even trust them because they didn't tell me that they were going to take me off my meds after I just looked these people in the face and told them that I'm in agony and I can barely walk. At this point, I don't even want to be here. I don't want to be here. I'd rather go home and deal with whatever I'm dealing with than to be here and be ignored. The fact that they took me off my painkillers on Sunday when I'm supposed to have a scan to see what's wrong with me on a Wednesday. Like, I hate white doctors so much. I hate them so much. I hate them so much. So much.
Honestly, seeing some of this clip as Black woman, I really felt the pain, the trauma, and every single thing that some of these Black women are literally sharing their experience. If this is the first time you're tuning in, welcome in. And when I saw this particular clip on my FYP, I decided to put out this video here, not for any reason, but for educational purposes. I don't know if there's any way, you guys let me know, is there any way that we can navigate that? You must not visit a white doctor, even if you are staying in America or any of this country that has all of this this. I don't know if it's possible, because I think it is high time right now Black people should go to Black doctors, white people should go to white doctors. Because what is all this? Look at the first clip I was able to roll out where this lady was literally lamenting. Look at what she had to pass through in the hands of these white doctors and nurses, knowing fully well that she is in pain. Why is it that whenever it's coming to Black people's end, they don't take our pain seriously? Why do they think that we have some anesthesia inside of us that can literally reduce pain or that don't make us to feel pain? It's quite sad. Is it women coming out to talk about their delivery experience? It is another annoying part that whenever you listen to it, you get so pissed off and you ask yourself, what have you done as a Black person to be able to deserve this? When I saw this video, I decided to roll out. Let's watch the other part of this clip. Credit to the original creators of every single clips and stitches we have in our today's episode. I want to say a very big thank you to every single one of you, liking, commenting, sharing, dropping super thanks. Also join my membership. I do not take you guys for granted. Guys, with that being said, let's go watch. I'll be back with commentaries.
I went to the emergency room recently because I was having some medical issues. And as they do, the doctors came up to me and asked me if I was allergic to anything. I said, I'm allergic to progesterone. He goes, what do you mean you're allergic to progesterone? And I was like, well, I don't know if I'm like allergic to it, but like it makes me very sick. I had to take it before, like during my pregnancy, and it made me so ill. I had a terrible fever, vomiting all the time. Like it was very bad. I cannot take it. And I have tried it more than once. He basically tells me like, well, you can't be allergic to progesterone. And I'm like, okay, but it makes me like really sick. Like I can't take it. He just goes, okay. And we continue on with the visit, right? So he tells me that my hormone levels are off, and that's like a huge part of what's going on, right? So we're trying to figure out what's wrong with me. I'm like, oh, okay, yeah. So he prescribes me a medicine. It doesn't say progesterone or anything. It was just another name of a medicine that I don't know because I'm not a doctor. Tell me why I go home and I'm taking it for a few days and I'm feeling like exponentially worse. Like I am doing worse than when I walked in. Every time that I start to feel worse, I'm like, I'm gonna take another one of these medicines because it's supposed to be helping me feel better. So I'm gonna take another one to make sure it's helping me feel better. And this went on for like a few days. I find the release packet from the hospital and I read it, and the first word on it was just a kind of progesterone. I was livid. I am livid. I have a baby to watch. I have things I have to do. I had a drop coming up and I was working my ass off, and he purposely gave me this thing that we had a whole conversation on, saying that I cannot take this, it makes me feel sick, for like what I imagine is just to prove a point that it wasn't going to make me sick. He gave it to me in a way smaller dosage than what I've taken before. So I wasn't like having a fever and having like all those like extreme symptoms. I was having like much smaller symptoms, but like way more sick nonetheless. And I'm just really frustrated because I really wanted to have this drop for Friday the 13th because it's supposed to be a day of femininity, and it's supposed to be a day of like femininity and like worshiping women. And I wanted to do something great for that. I wanted to have an amazing drop for this. And I just wasn't able to. I wasn't able to like finish everything that I needed in order to have that drop done, because this white man wanted to play around with my like physical health and safety. I just really wanted this drop to be done well. I felt like it was really important to me and to other people. I know that what I'm doing is important. I know people need the help. I want to be the person who can do that. I just have no idea how to in the circumstances that I'm given. I think the gist of my life lately has just been that like men are kind of the worst. I lost a very close friend because he was doing stereotypical dude shit. I became more physically ill because of a doctor doing stereotypical white men shit. I'm in an unsafe household right now and in constant survival mode because of a white man doing typical violent white man things. And I'm so upset about it. I feel like I have no control over anything that's happening. It feels like every time that I'm starting to be okay, like a man comes into my life and just like fucks it up. No, I'm gonna get all the like man hater comments and whatever. I'm so irritated. I'm so irritated. That was my ramble. Sorry that I didn't have my drop if you were waiting for it. But as of right now, I guess I'm just going to be trying to do whatever I can to be able to raise this money for the community gardens and for like a free store so that people can get whatever they need when they need it with no strings attached from the church or from the government, and give them a good alternative. As of a store or a community garden, I am so much at a loss right now. If you guys feel like you want to donate and help this cause, please let me know in the comments. Like, I'll make a Cash App or like whatever I need to do. I'm trying to figure out my website and set up donations on my website and stuff like that. But please don't feel pressure to. It's my thing to figure out, and I understand that. I just want people to get help.
This is my second time making this video. So like I was saying, I mean, y'all don't know, but I don't think people realize just how traumatizing it is for Black women to go to the doctor's office and the doctor does not listen to you and basically negates your experience. I had a panic attack at the orthopedic doctor office yesterday because I was trying to tell him my knee has been partially dislocating, which is called a subluxation. It's been partially dislocating since I was 10 years old, and like it'll pop out of place and then it'll pop right back. That's a subluxation. My MRI clearly said indications of a recent subluxation because just about a month or a month and a half ago, my knee popped out of place and then popped back in. And this is something that's been going on since I was 10. I'm 28 now. And I kept trying to tell him. And he's like negating my experience and swearing up and down that it's not a subluxation. And I think it's because he doesn't want to do the bigger surgery, because the bigger surgery would require cutting through bone and doing all kinds of extra shit. But anyway, I just think that it's so traumatizing when we try to tell somebody our experience. And, you know, as a Black woman, I'm telling you, I'm trusting you, an older white man, with my health. And then you're trying to tell me, no, that's not what's happening. That's not what you're feeling. You're feeling this, right? You're feeling this, right? And then I tell you no. You're like, oh, well, no. You know, that doesn't make any sense to me. And it was so traumatizing. I had a full-blown panic attack. And it took me back to being a little girl and being in pain, knowing that if I said something about it, nobody would really care. Nobody would take me to the doctor. It took me back to the multiple times when my knee popped out of place and nobody cared enough to take me to the doctor. They just sat me up on a couch, elevated my leg, and put ice on it, when really I should have been going to the hospital for that, or at least the doctor's office, to see if some type of tendon was pulled or torn or anything like that. But it just took me back to being that little girl that nobody was trying to help like that. You know, when I needed help, nobody was going to help. Nobody was really listening. And so it just made me feel unheard and unseen. You know, it was just a bad experience. And I think that white doctors can be helpful but they can also be very detrimental to a Black woman's health, because like even when Black women are giving birth, what happened to Serena Williams? You know, she gave birth and she was complaining about some issues she had. Didn't she have like preeclampsia or something? And she kept warning them. She was like, hey, I don't feel good. I don't feel good. I don't feel good. Nobody wanted to fucking listen to her until they finally registered, oh, this is preeclampsia. So it's a commonality, you know, with especially with white doctors. That's why I love having a Black doctor. My primary doctor is a Black woman, and she listens to me all the time. She never makes me feel like what I'm saying is BS or like I'm making something up. But that doctor yesterday made me feel like I was a liar, like I didn't know what I was talking about. He really tried to put me in a child's place, and I tried so hard to vouch for myself, but his ego would not let him just say, okay, let me listen to the patient. Ego and unconscious biases. He's like, oh, well, you know, maybe she's just, you know, she's just trying to get out of something. You know, maybe thinking the worst of me, not even realizing, but just doing it and not listening to me. And that was a horrible feeling.
Police to Black men is equivalent to doctors to Black women. And if you're a Black woman and you follow this page, you already know that. Yesterday, I was on the phone with my sister as she went to a doctor's appointment to see a new gynecologist. Now, to level set, my sister has the same endo symptoms as me. And as a lot of you probably know, like when you have endo within your family, you are 7 times more likely to have it. So she shows up to this appointment. I'm on the phone. And the way this man is talking, white man, is talking, I'm like, oh, this is not gonna go the way I want it to go. This is not gonna go the way I want it to go. This man it was so dehumanizing the way he was treating and talking to my sister. I cried. And I'm watching my sister tear up in this appointment and like trying to be strong and get through this appointment because of how she was treated, because this man thought it'd be cute to dismiss her emotions, to dismiss her pain and her symptoms and tell her, oh, just slap some birth control on it and we don't need to address endo because you're too young to have endo. You can't possibly have endo. If you had endo, you would have symptoms like painful sex. You would have gastro symptoms. You would have painful periods. My sister is like, I have all of those. You would have known that had you actually asked me about my symptoms before telling me what I do and do not have. The absolute caucasity of this man. And the thing that really hurt me is like, this is not a unique experience. This is something that happens to Black women every single day. Any Black woman, if you talk to her, she will have a story of going to a doctor and talking about her symptoms and either them not being taken seriously or pain being completely dismissed. I myself have literally had my pain dismissed in a freaking ER. In an ER. I need people to understand that this is dangerous and this is literally killing Black women. Like, that sounds dramatic, but when you have different symptoms, especially when it comes to your health, and you are seeking out medical care and the doctors themselves are literally gaslighting you, dismissing your pain, dismissing your symptoms. Like, thankfully, we had the knowledge to know, like, this man literally doesn't know what he was talking about. He called endometriosis I think he called it like a uterine condition, when I'm like, the whole thing is that it grows outside of the uterus. Like, what? But just hearing how he spoke to my sister, he literally had laughed. He had laughed when I was sharing my own experience, and I was like, yes, I have endo, I'm going in for surgery, and I'm advocating for my sister on the phone because I couldn't be there. And he thought it'd be cute to laugh and be like, oh, well, I guess we'll see what the laparoscopy says then. We need to do better.
And we need to hold these people accountable. You better believe we filed a complaint. You better believe we left reviews on every public site that we could find, essentially. So if you go to a Dr. David, what's his name, Ike Waltz in Cincinnati, I would suggest that you don't. I would suggest that you don't.
For the second time since I've started residency, I have had a patient refer to me as little black girl. We have established that I am a physician. I am a doctor on their team. The first time the patient said it to my face, and I was a first year and very kind of taken aback, but I didn't say anything. And second time, I heard it from a co-resident who was taking care of the same patient. The patient had referred to me as little black girl. I share this because in medical school, attendings tend to refer to themselves by their first name. And it just makes me realize that I will never be able to truly embrace that. If I tell them what my first name is, they're not going to assume that I'm a physician. Unfortunately, as a black woman, patients will always assume that I'm anything but. So I've made other videos addressing this before, and I'm fine with correcting, but it gets to a point where it's no longer respectful and you're no longer being treated in the same way the other people who are taking care of you are. I think it's just not the same experience when you are from an underrepresented group in medicine. You're not afforded the same privilege to say your first name and assume you're a physician. Anyway, just a little thought experiment. I'm curious if you guys have had similar experiences and what you've done.
As a black woman in healthcare, I've never been on that other side of healthcare. December, my fibroids were fibroiding. I was losing blood like crazy. I had a blood clot the size of my hand. I literally gave birth to it and I held it in my hand. I was weak. I was dizzy. I was short of breath. I took a shower. I had to lay down. Brush my teeth. I had to lay down. I was eating a bagel and I had to lay down. Because I had nothing in me. So I was going to the urgent care. Then I said, you know what? Let me bypass the urgent care and go straight to the ER. So I go to the ER. I said, hey, I think I'm losing too much blood. So I'm short of breath. I'm dizzy. I'm lightheaded. I am losing too much blood. So they sent me to the back. You know, they cross-match me. They take out the blood work. My hemoglobin is 9.5. Okay. But it's 9.5 and I'm still actively bleeding. When I tell y'all I bled all over those people's floor, I stood up and came out. He did a pelvic exam. Whoosh. So they did a vaginal exam. Soaked the bed, the sheets, the floor. I bled all over those people's hospital. And I'm crying because I'm so embarrassed because I'm just bleeding everywhere. So OB finally comes to see me. OB resident. You can tell she looks white, but you can tell she got that hint of color in there. And I'm like, I don't know. So she comes in, she has a student with her. So our student is asking me questions. She don't even look at me. She just, and then she'll stop and then she'll ask me a question. Then she'll go back. And she exits the room before the student. So the student is there. She's asking me questions. She's been real thorough with her exam. I like her. Chinese girl. Nice lady. So she leaves. They are doing absolutely nothing for me. Nothing. And they redraw my hemoglobin. Remember, 9.5. So it drops to 9. Mind you, I'm still bleeding. So eventually, the OB that walked out, she comes back in. She says, if you think you'll be okay, I'm going to go ahead and discharge you. If you feel comfortable with going home, you can go home. I'm still bleeding, y'all. My hemoglobin went from 9.5 to 9. I'm still bleeding profusely. She said, if you feel comfortable with being discharged, you can go home. I said, I don't feel comfortable being discharged. She said, I think you'll be okay. And then she walks out. So my nurse comes in, black girl, black nurse. So my nurse comes in and she says, what did she say? Because we have been waiting on OB for I don't know how long, for hours. I said, she said, if I feel comfortable going home, I can go home. And she said, what did you say? I told her I did not feel comfortable going home. And she said, that's what I'm talking about. You got to advocate for yourself. And then she comes in with some fluids. Because she's like, I don't know why they didn't give you fluids in the first place, because you're doing all this bleeding. That's the least they could have done. So she hooks me up to the fluids. They do another hemoglobin test. It drops down to 8. Mind you, I got to the ER at 9 a.m. It's probably a good 3 o'clock, 3 p.m. So my hemoglobin went from 9.5 to 9 to 8. So I guess they was like, okay, and I'm still bleeding. So I guess they was like, okay, she might be for real. She may be for real. So let's go ahead and give her some blood. She comes back and she said, do you want blood? I'm like, absolutely. Give me everything you got, lady. Everything you got. I can't even stand up without. Give me everything you could give me. So I get my blood transfusion and I get admitted. So I'm upstairs. I have my first blood transfusion. Then they come back and they stick you again that morning. They stick me again 3, 4 in the morning. I don't know what time it was. I knew I wasn't getting no sleep that day. They stick me again. Hemoglobin has dropped once again, even after the blood transfusion. Hemoglobin is now 7.6. So you with me? 9.5, 9, 8, 7.6. So they're like, okay, we're going to give you some more blood. They give me some more blood. That bag worked. Mind you, these are $3,000 worth of blood. So after that, my hemoglobin goes up to like 9.7. Even though I'm still teetering on that line because I was very much symptomatic at 9.5. But I think it was 9.7 like 6 months ago when my OB checked it. But my point is, as black women, stop letting these healthcare workers play in your face because they went to school for that shit and you didn't. If you don't feel right, say something. Had I not known better, I probably would have been like, all right, she said ain't nothing wrong with me. And if I want to go home, I can go home. I probably would have went home. And I probably would have went home, continued to bleed, and died. Because I remember before I went to the hospital, I laid down and I went to sleep. And I said, if I pass out, nobody would ever know. I said, if I pass out, nobody would ever know. Y'all, 2026, stop letting these white people play with y'all health.
If you're the only black person in a room full of white people, leave. The same way that I made a video before talking about if you're the only woman in a room full of men, leave. Same thing. You don't see the whites only environment. You don't get that vibe. If they could, they would definitely segregate that room to show you where you are not welcome where you are. I don't think y'all understand how serious it is. That's also another reason why I think Nolan Wells got unalived. It wasn't just the fact that people were clearly jealous of him going places. You're a black man going places. That's unacceptable. There can only be one, and it can only be the one that's the oppressor. I think people forget that. You are not one of them. You will never be one of them. Even when they accept you, you're just someone that they look at as, oh, you're so dumb. And we can get away with our shenanigans and our bullshit because we know you're not going to do anything about it. That is crazy. You can be put in so much dangerous situations to get laughed at, mocked at, and then God forbid it goes left, because it will, because why do they even put you in that situation to begin with? They will leave you behind. They'll try and cover up. They'll call mom and dad and the police office that they're connected to and the judge that they're connected to, and they will cover up your unaliving. I'm so for real. Or even if you survive the night and trying to go out of your way to go and tell, they might go and set up a way to unalive you so you don't ever say nothing and try and cover it up. These white people are crazy. You don't know what they're capable of. I don't think you want to be in a room where you were never welcome to begin with. And the only reason why you got through this door is because you were dumb enough not to see the red flags that we didn't like you and want you here. And you're just a laughing stock to us. But a lot of y'all not going to listen to me. Y'all saw what happened to Tamla, and now we have Nolan. Who's going to be the next one? I'm just waiting because I know it's coming.
Anyways, welcome back, guys, and hope you guys have seen every single clip, because I'm not going to be saying hope you guys enjoyed every single clip I was able to roll out, because there was literally nothing to enjoy there. This is exactly what black women go through every single damn time, and it is crazy that even up till now, a lot of women cannot just even come out and just share their experience with you. If black women come out in mass to share their experience, a lot of people are going to be wow. I don't know what black women have literally done to deserve this. And honestly, because I think as a doctor, your main aim, or as a nurse, your main aim is to save life. If you know you're not good in saving life, you're not good in such kind of field, please resign, quit. If not, why will you treat a particular race differently and treat another race differently? It's quite crazy. You can also hear from the clip I was able to roll out for you guys, where this black woman, this white woman literally said, black women are liable to die, like they are more to die during pregnancy compared to white women. This is because of a lot of things that have literally been going down, a lot of things that have literally been doing to black women. Even research have literally shown that. And sometimes I ask myself, why will I practice? And I said I want to save life, and when life come directly into my hand, I cannot save that life. I just leave everything to be going up miserably. Look at the clip I roll out for you guys, where this white woman was talking, where she literally have to add that particular clip. That particular clip, I even did a full video about it. That was somehow early this year, because this woman was literally in labor, and this white nurse had the audacity, the guts, the temerity, and the effrontery to sit down, and she was literally doing paperwork, ignoring every single thing that this woman was going through, even when this woman was screaming, even when this woman mother was telling her, why are you doing this? Do you guys get what I'm trying to say? It's just so sad that there is no how you are going in one way or other, that you're not going to be meeting with some of these white doctors. And I think if a lot of them are getting sued, honestly, it is absolutely going to be something beautiful, because I'm feeling that one of the reasons why a lot of them just get away with the things they do is because they're not being called out, or whenever they are being called out, they're not being sued. By the time they start suing them, east, west, north, and south, they will not understand why they really need to be treating people nicely. Okay? They will not understand why they really need to take their job seriously. Because you can't tell me you have a job to protect, you have a life to save, and you'll be busy doing nonchalant thing, or giving them one different annoying experience or the other. Black women has gone through different bad side of some of these white doctors, and at the end of the day, you keep asking yourself, how did we end up here as black women? It's quite sad and it's quite crazy, and I really, really feel for these women, to be honest. But let me know what you think in the comment section. Credit to the original creators of every single clips and stitches we have in our today's episode. I want to say a very big thank you to every single one of you, liking, commenting, sharing, dropping super thanks, also joining my membership. I do not take you guys for granted. You guys are absolutely the best. And yes, guys, with that being said, with no further ado, like I always say in my videos, I'm going to be saying bye, and I'll see you guys in my next one. For now, bye guys. I love you guys. Mwah.